Hi, YouTube. What's up? My name is Elliot, and welcome to my channel. If you haven't been there, if it's your first time watching, I am a non-binary trans guy, and I just had top surgery. Woo! And this is my top surgery reveal podcast with Niki, who's also had top surgery. And what we're going to do is we're going to talk about top surgery. So content warning, if you don't want to hear about surgical procedures, blood, anatomy parts that are female or stuff that happens to them, if you're uncomfortable with swearing, and what else do we do that's not cool? Thinking. We're pretty not cool from beginning to end. And so maybe if these things are not great for you, so maybe not watch this video. And okay, Niki, go ahead and introduce yourself a little bit.
All right. I feel like I should make a funny introduction because you say Elliot, Niki Foros, Niki. Oh God, please call me Niki. This is Greek names now.
Let's call me Niki.
Yeah.
It's a very Godfather name, Niki.
Godfather name, really?
Yeah, it's like it could be an old mafia name, you know. You don't have enough beard for that.
Come to me, and no, you have to let me do it now. You come to me on my daughter's wedding. Whatever. Now I'm gonna introduce myself now. Don Nicone. No, listen. No, mafia. Where did you get that from, guys? Similar situation, non-binary, transmasculine, blah blah blah. I had top surgery this year in February, and I'm going to have my revision in 2 days. Revision meaning it's going to be a minor procedure where they're going to remove a little bit of excess tissue. That's all.
Cool. So I had top surgery as in double mastectomy exactly 22 days ago. And I had it in Barcelona, where I'm currently living, with Dr. Moscatiello, who is actually kind of really good and really not very famous. It was pretty cheap. I paid under 6,000 euros, all included, including the PCR and all that shit. And I got a result that I am extremely happy with. And I think, Niki, we should really start by like showing our results. I'm gonna take this off like really quickly just for a second, just to show people, and you can do the same.
We're gonna do that. Let me add, because you said it. I had surgery with Dr. Schwarz in Schleswig-Holstein, Northeast Germany. The cost was around 9,000 for me, including hysterectomy and ovarectomy. And it got bumped up to about 11,000 because I had a single room. But I didn't pay for that myself. I got insurance to cover it. So that was that. Prices are very different depending on surgeon. Like, we have surgeons here who do it for 3,000, people who do it for 7,000, you know?
And also, I think it really differs from country to country. Like Germany is a more expensive country than Spain. Yeah. And absolutely. Actually, this surgeon that I went to, he wasn't a very expensive surgeon. I've seen all the other ones that I've seen were like 6,500 and up. So I did pay the full cost of my top surgery from my own pocket. But the amazing people on this channel and my amazing family and my amazing friends helped me by donating to my GoFundMe so that I actually got the whole amount from the GoFundMe, and I could even afford to pay for a place to be in. So I got, I think, 7,000 in the end from the GoFundMe. So all the money that was not going to the surgery went to get an apartment for the first 20 days that I could stay in, that my mom could come from Israel and actually be with me the whole time. And I could take those 20 something days off of work, and I could feed everybody, and I could like actually not be like this on the financial level because basically I'm working illegally and I don't have any money saved up. And it was like, okay, if I spend 20 days without working, I'm running myself into a debt, you know?
Yeah,
And
we should say that the reason you had to pay for it yourself is because you immigrated to Catalonia and sadly are not entitled to the benefits of public health care yet.
so actually I am entitled to the benefits of public health care if I want to wait 15 years.
I was like, what? Yeah.
I'm on the top surgery list. It's just another 14 and a half for me to get there.
I was on the waiting list officially for 14 months and that killed me.
God damn it. 14 months. It's like, how do you even plan your life?
Waiting for that appointment in specific was the first free one, yeah.
God damn it. I want to show my titties.
Do it, please.
Okay, so guys.
You go first.
This is a yeah, nobody wants to see your ass anyway.
I'm gonna get a paper bag real fast for my ugly ass.
Okay, so this is a compression bandage which they give you after surgery. You have one too, right?
I have the same one, yeah.
Okay, so what it does is it kind of like crushes your ribs in, and it's so much more annoying than a binder because it like cuts into your armpits. So I'm not supposed to be without this. I'm just going to show you really quick what's going on. I do have some bandages that I cannot take off, but you can see how flat everything is. So let's go. Oh my God, this feels so good. Okay. Amazing arm mobility coming in 1, 2, 3, go. Okay. Ta-da!
It fucking happened.
Oh my fucking God. Like, I do not have tits anymore. Nope. No tits here. Yay!
Nope, you're good.
Yeah, I am really loving this one. And this one is a little bit but fuck it at this point.
Yeah, you know, I was so impatient early after surgery, but it turns out what people were saying was exactly right. Within the first half year, your result changes so much. Swelling goes down. Scars, of course, change completely. If you had a free nipple graft, a transplant like you and I both had, that changes so much within the first 6 months.
So I had free nipple graft, and you can't see my scars, but they go like this. And I was really nervous about having scars like that because I thought if they went down, then it would look horrible. But actually, they're just shaped like a peck, and I really do not give a shit. I have a lot of swelling in this one because I had a bit of a fat lump around here, and they took it out, and in the process of taking out, they inflamed my entire upper pec area. And I have a lot of swelling around here. Also, I have like this chest deformity that your chest is sunken, and I can't tell you, like, you see, like my chest is like goes in.
Yeah, a little bit.
Yeah, like my ribs stick out and my chest goes in, so I have like this form, and I can't tell you how fucking happy it makes me to know that.
Definitely. My ribs stick out too. I have rib flare, but because I have hyperlordosis, so my spine is like this. That's why my ribs stick out. And it's, of course, much more noticeable now, post-op surgery, but it's fucking fantastic.
I mean, it's just, you're just happy to know what your fucking chest looks like, you know?
Exactly.
Like
how long are you going to wear the compression vest?
So I have another 8 days of wearing the compression belt because I'm supposed to do a 30-day. I understand that it's different with different surgeons.
For me, it was 3 weeks. Yeah.
3 weeks. Okay, so technically in like 2 or 3 days, I'm out of your count. Okay, so let's see yours.
Sure. I think we should notice here. A lot of surgeons don't prescribe a compression belt at all, you know. It's different from doctor to doctor. When I know a guy, who had to get I'm inclined to say a binder custom made after surgery, because the surgeon said the compression bed is not enough. Wow, like after top surgery, a binder, that's fucking, you know.
Man, I would have given a lot to have like a specially designed binder at this point. Like,
yeah. All right,
motherfucker, that looks good.
Yeah.
So what the hell are you having fixed? Because it's so nice.
Yeah, sure. And I said I'm having a revision because I have a little bit of tissue here.
Yeah.
You can see when my arms are down.
Yeah.
Those are called dog ears, like they're standing, right? I should mention here, cannot be dieted or trained away, because it was created by how your body healed after surgery. It's not fat that you added by eating, and it's certainly not muscle. So
yeah,
that's why I want to have that snipped off. And that's going to be, my surgeon says, like 20-30 minutes, and then I can go home.
So your scars are like completely straight. This is fucking incredible.
No, not completely. Just
so they go up a little bit.
Yeah.
Okay. That is some really
every
nice
surgeon
work.
has a different cut.
Yeah. And
I've seen guys, they have like cups, you know, and a lot of people say they don't want it because that tends to look a little bit like a bra cup. And some people have them go down, some have them go up. Some people have like an anchor here, because both of us.
I really wanted them to go up, and the surgeon was like, you know, that doesn't really mesh with the lines of the body, and he explained it aesthetically. And then I thought about it for a minute, and from like a physical therapy standpoint, this is tissue that's not going to be very stretchy, you know? And if you want full range of motion, you want the lines, like, look at what my shirt is doing. My shirt is doing this. So that's the direction that you want the scar to take.
Yeah.
For yourself to have like maximum mobility. Because if you do this and the scar runs perpendicular, like it's a straight scar, then you're not going to have full mobility. And if the scar is like this, instead of going like this, you're going to lose some range.
Definitely. And I mean, you are still bandaged up. I can show you. I'm not certain it will pick up well enough on the stream, but I've had so many complications too. And in the end, it all worked out. So my incisions became hypertrophic, meaning the scars raised. Then I had the silliest thing happen. 4 weeks post-op, I'm changing bandages. My nipples fall out. Nipples are the buds on top. This is the areola. The areola didn't fall off, thankfully. Really weird. This is a very common complication, actually, that the nipples will fall off, whatever. You wouldn't know if I didn't tell you, because the way it grew back, it looks really natural, in my opinion.
Yeah.
I'm not unhappy about it. The next thing that happened,
it's flat, but it doesn't look weird, you know?
No. And the next thing that happened on my transplants here, you can see that I have stitches here.
Yeah.
Yeah. I had keloids. So that's also when the scar tissue raises, but when it spreads. So my areolas were bigger than they are now, because I had more scar tissue. So my surgeon thankfully prescribed to me very fast an anti-scar gel, but silicone-free. Silicone can flatten scars, mustn't, but it can also widen scars. And that's exactly what we didn't want, because I was unhappy with how big my areolas were getting.
Yeah.
So we didn't want to widen those, and it worked. I'm still applying it every day. No complaints. So this and this.
Yeah.
Yeah, that's what I want to remove, and then we're done. I'm gonna put my shirt back on because it's getting pretty porno in here.
Okay, so I'm gonna like abuse the moment of attention to show my mobility. So absolutely. I have really amazing mobility for the stage that I am in recovery. And when I say mobility, I mean I move my arms and I don't feel any pain or any like pulling sensation. And I was explained by the enfermera, the nurse, that it's really okay at this point to be doing this already. So this is where most people are on like day 20, right? Now watch this shit.
Yeah, it's really good.
Yeah, I can go a lot further, but yeah. So this is not my full range of motion. It's actually quite limited for me because I'm an aerial acrobat, which means that I spend most of my fucking time just hanging like a monkey. And I have my arm against my ear in my full range of motion in a straight line with my body. Like if I do this now, then you can see there's like another 45 degrees before my shoulder reaches my ear. But it's fine, you know, I'm rehabilitating, I'm working on that. And that's going to be actually the tail end of our conversation, because we're going to wind back to surgery day and we're going to start telling it like a fucking Passover legend. Okay. You guys do that? You guys don't do that. You're not Jewish.
I'm Orthodox. That's good enough, huh? Just the wrong kind of Orthodox.
Like a Greek Orthodox.
I'm afraid so, yeah.
I'm sorry for you, man.
Yeah, me too.
And I'm sorry for me that I turned out Jewish, but no. I mean, I'm a very non-religious person. I don't want to offend anyone who is religious, but I'm very unreligious myself. So we have, the Jewish people, we have the most boring tradition in the world, where we sit every year at Passover, which is like Christmas for you guys, it's a big holiday, and we tell the same fucking story over and over again with all the boring details. And that's called coming out of Egypt, no? So whenever somebody tells like a really boring and overly laden with detailed story in Israel, you can make fun of him that he's telling the Exodus. Okay, yeah. Let's do that. So, surgery day. Or maybe the night before surgery, like how did you feel? What did you do?
Well, like I said, I was waiting for that appointment in specific for 14 months.
Yeah.
And I was put on a waiting list, and I was told before COVID happened that it could be they call me, and if I'm free, I can get an earlier date. Okay, COVID happens and this is canceled.
Yeah.
And I was lucky that my surgery even happened, because like I just told you before we streamed, a week after me, someone who was standing in front of the door was told he's not being let in, they had a positive case and everything is canceled. So I'm not really worried about surgery. I'm worried about it not happening at that point. And that's also because of a lot of fighting with insurance and whatnot, not just because of COVID. I essentially can't believe that it's happening yet. And I get really nervous 2 months prior when I know everything's clear with insurance. It can happen now. The week before, I get really nervous. And then the night before, I can't even explain. No joke, I didn't sleep a single minute. I was in bed for so many hours. I just couldn't sleep. I felt miserable. And when I got up that morning, like at 4:30 or something, to leave early, I felt dead. I kept falling asleep, but like I was being driven to the clinic, thankfully. It was so nasty. And I check in, and I said it's because you said the night before, because I check in the day prior. And we do all my paperwork, all the insurance, and do COVID tests and whatnot, blah, blah, blah. They again tell me what kind of surgery I'm having and if I'm consenting to this and complications. And then for the rest of the day, I'm left with my own thoughts and feelings. And I'm in the hospital already, and they expect me to really fucking close my eyes and sleep there. And then the next morning, I don't know if I'm even being operated on, or if someone has a COVID case, or if my blood work comes back so horrendously that they say, no, we're not operating on you. And that's exactly what happened. My blood work came back heavily inflamed. Normal stress response, I wasn't sick. It happens to me every single time. I try to explain it to them. They say, no, you must be sick. All COVID tests come back negative. I'm not having a cold. I'm not having a urinary tract or a bladder infection. No coughing, no exhaustion, nothing. And I say, guys, I feel like shit because I've waited for this day for all my life and I didn't sleep. And I'm so terrified that this is not happening. Of course, something is inflamed somewhere. Of course, I'm stressed.
Yeah.
And my surgeon, great guy, I hear him say this on the hallway behind my door. Yeah, of course, the blood work is inflamed. It's not a big deal. We're not sending this guy home because of blood work when he says he's feeling fine. He comes in and he says, you know, my colleagues don't want to operate on you, but I'll tell you how we do it. In the morning, I come back, I wash my hands, I draw on your chest where I make the incisions. Everything like we're gonna operate. If nothing disastrous happens until then, I'm gonna operate on you. Okay. They wake me at 4 a.m. I take my last shower for a couple of days. I still don't know if I'm being operated on. At around 7, my surgeon comes in, starts drawing on my chest, asks me, how are you feeling? I say, well, I haven't slept, but good. I'm not sick if that's what you mean. Says, no, I tell my colleagues. They draw blood again. Last time they did like 12 hours ago. It's still as inflamed as it was the night before. My surgeon says, yeah, of course, 12 hours later, it's still the same fucking rate.
Like the guy's still stressed, you know?
Half an hour before surgery, someone comes in. Like I have it in my head, like at around 9, they would come to wheel me into surgery. And I'm not hearing anything after seeing my surgeon. Half an hour, the nurse comes in and says, you're green lighted. We can operate on you. And at that point, I wasn't nervous any longer. I wasn't scared. I wasn't worried. I was just relieved. Because I knew no matter what happens now, I could fucking die on that table. But I would die happy because I'm thinking I'm finally getting towards where I need to be, you know? Ciao, tetas. Yeah.
When every time I say that phrase, I have like the melody in my head. The Bella Ciao.
I'm not gonna sing that now, but yeah. Ciao, tata, ciao. Yeah.
With like the side to side swing. Wow, that is one hell of a story. You always have like these fucking stories, man. Okay, so I have been waiting for this day for I want to say 12 years, because ever since I knew it was a possibility, I was like flirting with it since the first time I read Stone Butch Blues. You know, you read the part where they take their tits off and you're like, that's possible?
Yeah. Yeah, you said that last time. No.
Nobody ever told me it was possible. So from that point onward, I was interested in getting the surgery. And the more time passed, the more serious I got. And this year, when I realized I was getting it, it became really hard to wait. I became very dysphoric. I started having a lot of anxiety around the surgery, and the anxiety centered around really stupid stuff like, what if I wake up in the middle of the surgery and I feel everything? Does not happen. Like, happens, but isn't an occurrence that somebody should be worried about when they're going into surgery. Like, it's not statistically a thing.
No.
And I've had major surgery before in my back, and the surgery that I've had on my back was brutal to recuperate from, because it was bones and nerves, and
yeah,
it was a whole ordeal. And I had a lot of fear around rehabilitation, like, will I be able to go back to my sports and stuff? And I spent the last, I was supposed to have the surgery on July 13th, but I switched doctors. I was going to go with Tito Brazo, and then I saw this guy, which I wasn't even going to see like seriously. I was just like, just to cross him off the list, to say that I've seen everybody, you know, some guy like kind of recommended him. And I went in and I see he has amazing results, and he's like very professional and cheap. And I asked him, like, why are you so cheap if you're so professional? And he's like, I don't think these things need to cost so much because it's not an aesthetic surgery. And I'm like hearing a plastic surgeon say that really got my confidence votes. So,
and he was a plastic surgeon.
He's a plastic surgeon. He does like nose jobs and breast enlargements and chiseled jaws, you know?
I asked this because mine is a gynecologist who
Yeah,
at one point started to specialize in trans men, which is really rare, I think.
I think it is. I think most surgeons who do this are plastic surgeons. And I'm really surprised at how good your results are, given that he's not a plastic surgeon, because this is a big skin thing. Like, this really is a skin surgery, you know?
Yeah, he's one of the most popular guys in Germany.
So he's got a lot of experience.
I think he's done over 2,000 mastectomies on trans men.
Nice. So I don't know how much my boy did, but he's been doing this for like 4 or 5 years, and he says he does 4 of these a week. So for a week, he's an Italian working in Spain. So let's say 30 weeks out of the year. So and
I relate to this so much, but okay.
So he's done a few. But he had, like, you know, as an Italian working in Spain, he wanted to take his vacation. So my surgery got bumped up to later, to August. And I was like, and then I was like, no. I want him when he's back from vacation, when he's like tranquilo. He's had his time on the fucking island to drink his mojito and be happy, you know? Like, I want the guy chill.
You come to my surgery on the day of my vacation.
You come to my clinic. And you ask me to. So, I went into the surgery with such an anxiety that the month before, I had managed to quit smoking weed, which is huge for me because I smoked weed every day for like a year. And I sort of spent the last month with like an eating disorder. I didn't eat anything. I lost like 5 kilograms. I don't know how much that is in pounds. 2 point something. So I lost
around 8 or 9 pounds.
8 or 9 pounds. Okay, so I lost 8 or 9 pounds.
That's a lot in a month, yeah.
Yeah, and it's like I didn't have a lot of fat on me, so it was probably like muscle too, you know. And I was really like waking up at 4 a.m. to think about stuff, and I was really like, you know, like this all the fucking time.
Yeah.
And it was emotionally difficult, but the thing I wanted more than everything was just get to that day and pass that day. And I didn't know who was going to be with me during surgery because my mother asked to come from Israel and she was not given permission to leave Israel because at the same week when she had the flight, they declared Spain to be like a red country because of Corona, so she couldn't travel, and she had to ask for the permit again. And the second time that she asked for the permit, she was approved. Yeah, so we didn't know until the last moment because they canceled her flight and she had to take another flight, and we didn't know if she was going to get here on time, if she was going to get here at all, or anything was going to change. And the last night before the surgery, I was trying to be with my friends to kind of like, you know, in the morning I trained to take some of the anxiety off, and because I love training, and to kind of like swan song the last time that I'm going to do like hard exercises for a while. So I did shoulders, and then that very day I stayed up until like 2 p.m. with just my friends talking about like trans experience, and it was a really, really, really good way to soothe the anxiety that was going on because I was like surrounded with friends and trans people and talking about these things, and not being alone was a huge part of it. And I went to sleep at like 4 a.m. and my mother, who'd arrived the day before, woke me up at like 5 because we needed to be at the clinic at 7:30. And we go down to the clinic and I forgot all the documents that I was supposed to bring. I just fucking left the document bag there because I was so nervous and I thought they were going to send me home. And no, it was fine, you know, they admitted me and they said, go up. And I go up and it's like a fucking hotel room, you know? I get my little bag with the stuff that you're supposed to wear that's open in the back, and the little shoes and the little hat, and I'm wearing all these things, and I'm feeling like a very freakish housewife. And I come out of the room having changed, and it's exactly in front of the nurse station, right? So there's like 4 of them, and they're all like situated like very cinematographically looking at me when I open the door. So of course I go, do I have to do something, ladies? And like, and then they're like, no, we'll call you. And it was a good tension relief. So I go back in the room and I wait, and at a certain point they come in with the bed, and they wheel you out, and we go down to the surgery theater, right? And
this is all happening the same day.
This is all happening the same day. This is like, I'm admitted. I get there at 7:30. I take a few photos with my mom. By 8:30, I'm already up in the room.
Mm-hmm.
They wheel me out at like 9. I tell my mom, don't worry, I'm going to be fine. She says, and I can already see her crying. And I'm like, God damn it. And then they wheel me out, and we go down to the basement with a very, very, very sweet crew. And they start by asking me 5,000 times if I'm allergic to anything, if I've had general anesthesia before, and all the rest of these like responsible questions. Is there anything you'd like to say before any last words? So I say, I'm really afraid that you won't give me enough anesthesia and I'll wake up during the surgery. And they're like, what's this guy going to come up with next, And I have this thing where like, when it's around medical professionals, I'm extremely nice because I'm very anxious about how they're going to treat me. So I'm like, I'm smiling a lot, and I'm very forthcoming, and I'm joking with them, and I'm being very helpful. And inside I'm like, oh, don't kill me, And they looked at my blood work. It was fine. So was everything came back just fine. And then the doctor shows up, and he's like, okay, let's go into the room, and I'm going to paint on you. And he takes the little thing, and I strip the thing, and he starts painting, and this is where my head goes, click, this is happening. That moment when he paints on you and you're like, shit's coming off.
And you know what? I still remember standing there in front of him, taking my shirt off. And that was actually when I had my consultation. I took my shirt off before so he could tell me what kind of cuts we would need. And I was thinking, this is the only guy in my life I've ever taken my shirt off for. Better fucking appreciate that,
So in my consultation, he goes, what kind of how do you want your nipples? And I'm like, what do you mean? Is there like a variety? And he's like, look, dude, I can do them like triangles or hearts. I don't care. And I'm like, this fucking guy.
I had my consultation right before Christmas. And he said to someone in the waiting room, yeah, we can give you stars or Christmas trees. I was like, oh.
I think these guys are so bored than just doing brown nipples,
Yeah.
And then he goes, can I see something? And he just grabs the tit, he just grabs the nipple and he starts moving it around. And I'm like, no, actually, I'm fine with this. I'm absolutely fine with it. And I'm like, you're probably the only man to have ever pinched my nipple.
Yeah, right.
Keep it.
Fuck.
No, actually, don't keep it. Keep the rest of the tits. I want the nipple. And he paints on me, and then they ask me to lie on the table, and I lie on the table, and they're like a sweet like surgical team. There's about 6 or 7 of them. They're all smiling at me. They're all being very, very kind. And they had like, the sweetest thing was that they had like colorful masks. Like the surgical masks had little like paintings on them. And I felt like a child. I was so thankful for this because it was really like not scary. You know what I mean? And the anesthesiologa, the woman who put me under, she says, where would you want to be right now? And I'm like, here. And she says, where would you have gone for vacation? I'm like, I always wanted to see Machu Picchu. And then all of them said together, to Machu Picchu. And they gave me the anesthesia. And it was such a huge difference the way they put me under from the other surgery that I've had in my back. when I was so scared. I was so scared when they put me under for that surgery that I literally had to suppress the urge to grab one of the surgical knives from the kit that was open next to me and start stabbing people because I was so scared.
Yeah, I know.
You know? And because they were so kind, I was like, it's like going to Disneyland in my dreams.
You know, it's really interesting that you had such a positive experience. Really outstanding team, obviously. Like I said, my surgeon really boxed for me, you know, really was on my team. The nurses were great at the clinic. The surgical team right there at the time of surgery, you know, this is so ridiculous, but I was at a clinic that works with more trans people than anyone else. And so many people that kept misgendering me. And I'm not talking about other patients. I mean, the assistant doctors and whatnot. And so I'm getting a sheet with my name on it and everything says Mr. and female to male, transsexualism, transgender, blah, blah, blah. And the assistant doctor comes in and he keeps referring to me as a woman and whatnot. And I'm like, no, absolutely not. And when I'm wheeled into surgery, one of the anesthesiologist assistant goes, "You are Mrs." I'm like, no, your paper that you are reading my name from says Mr. It literally says female to male transsexual. I see it. And he says, whatever, and turns around. Like, what kind of behavior is that? But at that point, I didn't get upset any longer. I just figured, power through this, you wake up and everything is better. And I was alone. I didn't have anyone accompany me. And another difference, you left pretty soon after. I stayed for 6 days at the clinic. The reason why I stayed, it's normal in Germany that you're admitted to a hospital and you stay in the room. Nothing's keeping you from leaving. You can leave anytime you want to. But I don't have any trans supportive doctors here. And I figured if something goes wrong, be it top or bottom, and I go to the local hospital again, I only made bad experiences. First of all, they're probably going to absolutely ruin my surgery result, aesthetically speaking. But honestly, I'm worried about dying after this. So I stayed in the hospital. It was really difficult, not because I was alone. I was glad, but I was alone. And due to the COVID situation, we also weren't allowed to take guests. So I was completely alone for 6 days. And that was really good for me because I don't like having a lot of people around me, and having the nurses and doctors come in all the time and hearing people out on the floor see other patients, that was terrible. Like, I don't know if I would have survived this hadn't I been given a single room, which I've only been given due to my disability. Otherwise, people don't get a single room. But yeah, the very second that I got wheeled out of surgery and I wake up, I'm just better, you know, even though I'm really stressed and everything surrounding it wasn't optimal, everything was better still.
Wow. I am just like shocked that you did this alone for 6 days.
Yeah.
Just fucking mind-boggling. I mean, that must have been really horrible. like you're really tough guy, but
yeah,
it sounds horrible.
I think for neurotypical people, it's very bad. For me, I was glad that I got to be alone, because normally I would have been in a room with 2, 3, or 4 other trans men. They have a wing for trans men so that we don't get mixed with women and with cis men, because those surgeries are very intimate, right?
Yeah.
Okay. But, oh God, honestly, the most difficult thing about the hospital stay, I was thinking, was being in a room with other people. So I was glad that didn't happen. And without visitors, I could live very well. You know, I just spent my time reading. That was it.
Wow. So they wheeled me out of surgery and I'm like, hey, you know, I'm really under a lot of anesthesia. And apparently I'm like a pretty lightweight, because I came out and they kept telling me like how drowsy I was and how like I was complaining about a lot of pain. So I got a lot of pain meds, and they wheel me out, and the physical therapist inside of me is like, okay, breathe, cough, move. And that was the wrong thing to do, because I felt very little pain, like I was really on a lot of drugs. And I think I was doing like this even after the surgery, and I was using my phone, and I was like getting a sip of water, and I was moving in the bed, and I was breathing and coughing and all the rest of it. And I was feeling absolutely great. And my mother was there. She was very happy to see me move around a little bit. Of course, I needed help with like peeing and shit. She was able to help me, and no big deal. So the surgeon comes in to check on me. I leave the surgery at 1, and he comes at like 4 o'clock, and he looks at my drains, which I had 2 of, and he says, uh-oh, because my right drain was draining a lot of fluid. I think at that point, in the totality of that day, I had lost approximately half a liter of blood. And he goes, I don't like this, because you lost a little bit of blood in surgery and you're bleeding now. And he opens the bandage, and he looks, and I remember there was a swelling that kind of looked like a tit. And I was like, fuck is that? And he's like, yeah, that's a bleed. And we're going to try and like compress that, and we'll see. And he checks in again at like 6, and he goes, let me put my entire body weight on top of your chest for 5 minutes with my hand to see if we can stop this shit. And he opens the thing, and he goes like, have you ever seen like life support? And he goes like this with his entire weight on my right chest. And I'm like, do whatever you got to do, man, and there's a lot of bandages, and it's really like the whole thing is soaked with blood, and it was quite gruesome, to be honest. I was really like, I told my mother, like, please leave the room, I don't want to see it. And it felt like a little bit, I think if it was someone else who didn't have like a lot of medical education, they would have freaked the fuck out. But I was like, there's no real damage. Like, he can't break my rib cage, and there's nothing going on here, So he does that, and he presses, and it doesn't work. And he's like, okay, if you're still bleeding at 9, we're going back into surgery.
Yeah, that's very common, by the way. That happens to people.
So he explained it to me, and like, I moved too much. And come like 9 o'clock, he comes into the room, and the drains is still going strong, and he's like, okay, we're doing this. And I'm like, okay, well, let's do it then, And they wheel me down into the surgery room again, and everybody has this face like, this fucking guy, like, what'd you do? What did you move? And I'm like, I'm sorry, I'm so sorry. And he's like, no, it's not your fault. He was a really calm guy. And I'm like, you're the nicest surgeon I've met. And he's like, really? And I'm like, yeah, maybe it's a culture thing. Like, in Israel, they're not nice. And
you know why he was so nice?
Why?
Because you came to him on the day of his daughter's wedding.
I think he has like a 2-year-old son, and he was just back from vacation. Maybe that's why he was so nice. And he came in with his little hat and everything. He was like so ready to go home by 10. He was not happy to stay there and operate again. So I don't know what time they wheel me out, but they tell me, don't fucking move. And I'm like,
yeah.
And from that point on, I really I asked to be tied so I don't move my arms. And I only used the phone like if it was like leaning against my knee, so I don't do that. And I really stayed like that. And I was so afraid for a week that I was gonna do another hemorrhage. And what ended up happening is that I had an artery pop, and that's not something that you can stop with pressure. Like an artery, you have to go in there and burn it. So what was your complication? Because you also had one. Did you have a surgery complication?
Absolutely not. Just what I said when I was back home with my wound healing, that sporadically I had a piece here, a piece here, a piece here, do funny shit, but in the hospital, everything went as planned. And I mean, I have a very high pain tolerance anyway, but I said to them before, like I told the I told the entire anesthesia team, no opioids, nothing. I don't handle them well, and they don't work as painkillers for me. I'm just gonna throw up for the next week, so let's not do this. They say, okay, do you want any painkillers? I say, I don't know. I'll tell you after the surgery, right? So I wake up and I'm not in pain, and they just put me, I don't know how to say in English, but
say it in German. I might know the name.
Yeah, I don't really know in German either, because I hadn't seen anything like it, rather than something that you wheel around with you.
Okay, so it's like a drippy thing that goes into your vein.
Yeah, but not that. They gave me a machine that they hooked me up to with a handle. It looked like one of those old cameras, with the handles. And I look at it, and they just inject into it like they would with what we said. They just inject a little bit of stuff into it, and I suppose I say, oh, a little bit against nausea and a little bit of ibuprofen. I say, okay. And they left me on that machine for the night. And then the next morning at 6 o'clock, they take me off of it. And that's all I had. Then they asked me, do you want ibuprofen? And I got pills for the next days, nothing else. But like I said, I have a very high pain tolerance. So don't go into top surgery or any surgery expecting you don't need painkillers. Most people do.
So,
but my drains were filling nicely. They checked every day, twice, once in the morning, once at night, how much fluid was draining. Mm-hmm. I had 2. They told me that people who are very large at times get 3 or 4 drains. I didn't need those. And then, after 6 days, they read in milliliters how much was draining the last day. And they said, this is within norm. We remove them. You can go home. And a lot of people.
How many days did you have drains in total?
5 days. Because the 6th day I come before and we do all the formalities, and then the next day is surgery.
Yeah.
And a lot of people say that pulling the drains is the most painful thing. It only tickled for me.
Yeah.
But you have to see, you don't really feel a lot in that area. Most people are numb, really, for the first week or 2. And what was unpleasant was having the drains in, but not because they were painful, just because, like I said, the nerves were regrowing, it was tickling a little bit, there was pressure. And they said to me the first night after surgery, if a drain comes loose at this point, you have to go back into surgery because you might bleed out otherwise. But no, everything was good. And I remember being surprised that no one was coming to get my my plates and my glasses when I was eating. The nurse said to me, yeah, you bring them back. I had to bring them back into the kitchen. And my surgeon said, no, do everything yourself. And like I said, I had lower bottom surgery, I had a hysterectomy and whatnot. And I remember being a little bit cold and going to my suitcase and getting a pair of socks. And instinctively, I squat down to get them. And I'm squatting down, and I'm thinking, oh, am I allowed to squat down? But I'm right in the squat, right? I'm thinking, well, if no, then now it's too late. And I get up. And here's the thing, I don't see my surgeon for the next 3 days. He really has to do something for his money. And I said, yeah, so I squatted down Tuesday night. Is that a problem? He said, no, you can squat down as much as you want to. So they wanted me to be completely independent, right? And yeah, I went to pee myself. And on the day of my release, 6th day, I got to shower by myself.
Wow.
Really independent. No.
Wow, that is a very different experience from what I had. Wow. Okay, so because I've had 2 surgeries and I lost approximately 1 liter of blood, I was very dizzy. I came in with a 16.3 hemoglobin, and I went down to a 13.3 in the last blood test. And I was very keenly aware of the fact that I need to stand up and I need to walk to the bathroom. I need to use the bathroom, right? Because of the physical therapy education. And as I sit on the bed, the world starts going, wee! And I'm like, what the fuck is this? You know, I'm young. This isn't such major surgery, but the blood loss really, really makes a difference. So the first time I stood up, I was like, nope. And I sat the fuck back down and I had to sleep for an hour and eat something. And when I tried again, the floor looked a little bit more steady. And I swear to you, those 5 fucking steps to the bathroom was the scariest moment in the entire process. And I got to do that. I think 12 or 16 hours out of surgery. I couldn't do it before.
I went to pee right when I got wheeled into my room. So I wake up, my surgery was 2.5 hours because they were doing both things at once. And that's in the morning, right? And I wake up in the afternoon being really there for a moment, but not too long. And I, just like you, I fall back asleep. And then at night, around 6 or 7, I'm in my room. And that's when I'm on the phone and I eat and I can turn on the TV. And first thing I did is go pee. Like I said, I did most things myself. Yeah. So really different experiences.
Yeah, it's really different because like they told me don't fucking move. And I was like, I could move, but I chose not to for the sake of the surgery. And I had my mother like give me water with a straw and like I ate like this. You know, and it was really like I didn't want to do this to touch the tablet, so I did this because they really had me like scared of moving. So when they discharged me, I took a few steps into the hall and everything started turning black. So I look at my mom and I go into the fucking room, you know, and I say it in Hebrew like לחזור לחדר, לחזור לחדר. Or maybe I said I needed to sit down, which is אני צריך לשבת, you know? And I got to the bed and I sat down and it was like almost the end of the movie and then they turned back on. And I was like, I was going to faint. So they had to wheel me out in a wheelchair and we were very careful when I came out of the taxi to stop next to a bus stop so I could sit. And then a friend went behind me and I was like this, you know, and he had one hand here and one hand on the other side and he was holding onto my pants. So if I crashed, because what happens when you faint is you fall directly down. So he wants to be there that if you fall directly down, he will stop you by your armpits because there is no way to be quick enough to grab someone who's fainting, you know? And I had 4 steps to climb, slowest 4 fucking steps of my life. And then we got into the house and we put chairs everywhere. So if I take 5 or 6 steps, I can sit down. And that was the first day, you know? I had drains for 4 days, not because they stopped draining, but because I was explained that it was a risk of infection if I kept them in. So I was actually still bleeding when they took them out. And that was a source of anxiety for me, but everything is a source of anxiety for me. I was on a lot of painkillers, and at the hospital, they only gave me like anti-inflammatory, which is really soft medication. And when I got to the house, I had like the painkillers that I take for my chronic back pain, which are like heavy as shit opioids painkillers because they really work great on my back pain. And I was like, give me some of that because I was in a lot of discomfort. And the faja that I use, faja is like a bandage. So I'm going to show, they actually gave me this, which is like a 3-fold. I have a 2-fold. And when they gave it to me, like the stuff was so long, like if I close it, you can see that it goes down to my waist and a little bit under. So that shit was digging into my ribs.
Yeah, yeah.
And the pain from it digging into my ribs was so
It drives you
excruciating
nuts.
that it was just rib crushing. It was absolutely terrible. And I couldn't do this.
Did they release you with just the compression vest, or did you have something underneath it?
I had underneath it, I had huge bandages with a kind of tape that was very not skin sensitive. And it was actually like one of the most painful parts were the way that this tape kind of pulled on the skin. Like the tape that I have on right now, like this tape,
Skin
is
friendly.
it's a little bit more skin friendly, but the big point is that I change it every day. And the tape that I had on had like the adhesive was a little bit more aggressive, and I couldn't change it for 7 days. And the shit just tore my skin. Like, this is the part where if you're not into everything that we're talking about, maybe you wanna like change the video. Because what had happened is it peeled off the top part of my skin, and because it's August and it's very hot, you know, and you sweat and you move, so it just opened my skin like all around here, like all around here from the back part. Like here I had like an open sore that the skin had completely peeled off, and here like all of this area was like kind of raw, and on the other side and on the bottom part. And what we started doing is just we would wipe it down with wet wipes, and then we would go over with like antibiotic cream. And then when that dried off, we put talc on it so it wouldn't rub. And then we put like little gauzes so this part wouldn't chafe so much.
Yeah, I know.
Yeah, and none of that shit helped. It was still painful.
You know, I asked this because when I was in hospital, I had underneath my compression vest also a heavy bandage. Matter of fact, two on top of one another.
Yeah.
So that there's pressure and hopefully less swelling and less fluid buildup. And I'm released with one bandage and then the compression vest. Yeah. And they tell me, keep that on for, I think that was the next 10 days. And after that, you remove everything. You remove the bandages, you remove the tape. And from then on, every day, you take the shower head and you browse your nipples. A lot of surgeons say don't ever do that. Mine says does it, but it depends on the technique they use. For blood flow, it worked. Now, and then he said to me, don't change the tape every day, change it every 5 to 6 days. And then after 3 weeks, I don't have to wear a compression vest anymore, but I still do when I'm walking with the dog, so that it's a little bit more stable and whatnot. And ever since then, I've just been taping when I'm working out, essentially. And I've tried many different types of tape, and I can tell you, at one point, your skin has fucking had it. It doesn't matter how skin sensitive, how skin friendly it is. At one point, you will be peeling off your skin.
This is really true because there's like, it's your skin is not made for this.
I'll be charging my phone for one moment, yeah?
Yeah. So it's like, I'm using tape that in any other kind of circumstances would be like hypoallergenic and super comfortable. And it's really like not a big deal. But because you're constantly putting and taking it off, your skin is like irritated and red, and it's really uncomfortable. And that is actually one reason why I'm thinking about going with the silicone stripes, because you don't have to change them every day. The silicone stripes, you can actually kind of put them on until they fall off. At least that's what I was explained. And the other option is just to keep taping. So I think I might go ahead and invest in the silicone strips, even though they're extremely expensive. They're like 80 euros for the box that I need, and I don't know how long it's gonna last me.
For me, 150. So I never, and I'm not being prescribed, so I say no, forget about it.
And the other option I was told is you can rub an oil on it. It's called, in Spanish, it's called rosa mosqueta. I don't know what, something rose. And
yeah, this is another thing where a lot of surgeons have a lot of opinions. Mine says, don't oil, don't massage. keep them dry. A lot of other people say coconut oil, even olive oil, some say, well, jojoba oil, all kinds of stuff. And eucalyptus and tea tree, whatever, that can work. I think if you trust a surgeon enough to perform the surgery, trust them enough to stay with the recommendations for post-op care.
Yeah, just do what your surgeon says, unless you really have like grounds to doubt that they know their shit.
Sure.
Like
I'm saying this because I know all the surgeons have different recommendations.
Yeah. So after 7 days, I went for my first cura, which is like when they kind of like look at you. So the surgeon hasn't seen me, the surgeon hasn't seen me since the hospital, which is like 6 hours after surgery. He's fine. He's like, send me a picture of the drains in the morning. So send him a picture of the drains in the morning. He's like, it's fine. They're coming out tomorrow. So I go to the clinic. By the way, this is all on WhatsApp. Like the surgeon gave me his number so I can send him a photo on WhatsApp. And this is Spain, this is like he's being very informal and very kind. And I speak to the clinic on the WhatsApp. They answer me like within half an hour. Everybody's like super smiley. And I really have to say that this aspect of Spain is fucking adorable. You would never get this kind of treatment in Israel. So I go into the clinic after 2 days to have the drains removed. So the nurse opens the bandage and she strips all of this fucking glue, and it's like my mom is there and she's like, ah, and my friend is there and he's like, ah, and I'm like, take it off, baby,
At this point,
I don't feel anything. What I do feel is relief, because this part that you're like taking off is what's been bothering me like crazy.
Yeah.
And I get to see my chest.
True.
And I'm like, take photos. And that moment when they're like taking photos of your chest and you're like, I need to see those fucking photos, man. And then what else was going on? She changed to a very like small bandage and closed me up again. And because I had felt that now the left titty was actually kind of swollen, I rolled up some toilet paper and I stuffed it in the cleavage so that it bumps up a little bit the pressure. And I went back home and she says, you don't touch it. You just keep it that way for a few more days. And as she closed it, I tried to be a big tough guy and I said, no, I don't think it's tight enough. Go ahead and close it tighter. Kids don't do that.
Mm-hmm. Yeah, it's interesting. I know a lot of people have this aftercare that they go back to hospital or to the office, whatever, to have that looked at, the drains pulled, or the stitches taken out. Like I had self-dissolving stitches, right? I never saw my surgeon again after it. I have his email address, and when I wanted the revision, he told me to send him photos. So yeah, he's approachable that way. But I didn't have a post-op meeting with him again, which I guess is pretty unusual. But because he's so far away from me, all the better, you want everything to go right the first time.
Yeah.
So I'm having all of that taken care of release day, and then he says, whatever, the stitches come out the next 2 or 3 weeks, or maybe the next 2 or 3 months, but they come out on their own.
Yeah.
And I too had swelling, but not because of hemorrhaging or anything, just a little bit of fluid buildup. And this is something I really want to say for people who are looking to get top surgery. You will not expect this before, but because of the swelling and because of maybe how your scars or your areolas heal, it could be that you get a little bit dysphoric because you think, I'm out of surgery now and all of this is flat. But then the swelling will kind of look like breast tissue. It's not, it's gone. But for a couple of weeks, maybe a couple of months, you have to be very patient, give your body the time, because I come out of surgery, I'm flat. Within the next couple of days, I have a little bit of swelling here, and that made me really fucking unhappy. It's gone now.
Like, you really have to also take into consideration that you might have dreams where your teeth grow again,
Happened plenty of times.
Yeah.
Still can't believe they're gone.
Yeah,
Every time.
it's just the way your brain is wired, it's expecting you to have titties.
Every time that I get stressed, I touch my chest as a grounding exercise.
Yep. Yep.
Because it feels different from binding. It's not, oh, I'm binding, and for a moment to the outside world, it appears like I don't have something here. No, it's gone, and I can feel my pecs.
So the first time that I got approved to walk outside, because I was like under very heavy restriction, like the surgeon was like, home, bed, bathroom, sofa, you know, don't fucking move. And after 4 days, I was like, may I please go outside and walk 10 minutes? He says, yes. And I was very, very excited. And I went outside. It was also very sweet because I went outside with the guy I was dating. So it was like, oh, and I'm super happy. And I go outside and I start walking. And it's the first time that I'm walking more than 10 paces in a row. And you know how when you walked before top surgery, your breasts walk with you? They did not do that anymore. And that was the moment that I understood that I feel my nipples were not here.
Yeah.
They were here. And it's like a distance, right? And you don't actually feel the nipple, you feel like the wound around where the nipple was transplanted. But if you try in your head to connect that feeling with what your nipple used to be, you can actually, in a sense, start to feel your nipples. Like if I close my eyes now and I go like, okay, where are my nipples? I can place them on my chest, which is something that you're not supposed to be able to do until long after surgery, because you don't really have sensation. But because you can feel the wound, you can map that, you can do that actively with your head. And the first time I did that, I was like, I did it intuitively because I'm very in my body, I'm very aware, I'm an athlete, it's my thing. And I stopped dead and I started smiling like a stupid kid. And I was like, this is really real. Like, because I was with so many bandages on, I couldn't see it. And I hadn't had a moment to be just in front of the mirror and touch myself. I was just like, it did not sink in for me. But that moment, walking, feeling the pec, feeling the nipple, I was just like, it's done, you know?
I had the same sensation when I was taking the stairs in the hospital. I drank a lot to get the inflammation down and to keep the swelling down, 4 liters a day. And 4 liters of water is not so funny. Like Google says, it's 135 ounces. I don't know if that's correct. 4 liters of water. And I'm walking around the hospital trying to find a vending machine or something. Like something to get a cola or a coffee, something, I don't know. And I have to take the stairs into the basement to find this damn fucking cola machine. And I notice nothing is jiggling. Because when I took the stairs up or down, I would either place my hand here or my arm because it bothered me so much.
Yeah.
Even when I was binding. And I'm busy keeping my drains to the side and nothing is moving there. Like it's a thick chest still because, like you said, I'm wrapped up. There are multiple layers, but nothing is moving.
Like just that fucking feeling, you know, that there is no residual movement.
Yeah.
And you know, when you're in the binder and the binder is super tight, you can still feel them like moving against the binder.
Yeah.
Gone.
Nothing like it.
Nothing, just the silence of bandage on skin.
And you know, this is a good moment to notice this. When I was walking around the hospital, like I took a bag with me for the drains, right? I took a bag so that nothing would happen there. And I figured people are staring at me because I have drains coming out of my rib cage, right? Or like people know I'm trans, or people ask themselves, is that a boy or a girl? And then on my day of release, I noticed the reason they have been staring at me is because of the bag, not what's inside. My mom gave me a bag to take with me.
You're a dumb fuck, man.
I translate.
To protect
our
our
environment.
Our environment.
And
Okay.
then a gay toad and a gay turtle. Rainbow, kissing.
I love that bag.
My mom has kept this bag since before I was born. I love it. I steal it all the time. Obviously, I've just stolen it again. That's why people were staring at me, not because I had drains. Because of the gay toad, environmental, turtle, hippie, vegan.
Oh my God, this is just precious. This is just precious. Wow.
I fucking love that bag.
Wow.
Stare at me. I don't give a fuck.
Fuck, man. Oh my God.
I walked around with this for 6 days without noticing.
No fucking. Wow. It's really like when you're out of surgery, your brain doesn't have any spare change. You know what I mean? Like you're not bored. You're just fucking fuzzy. You know, I didn't even watch, like I tried to watch Rick and Morty. It was so hard. So 4 days out of surgery, look, yeah, I think 4 days out of surgery, I get my drains removed. And the bandages on the 7th day. And then after the bandages were changed, I went home with the smaller bandage and I went home with the huge faja. And that night, because I had been a brave, stupid boy, and I told the nurse, no, tighten it more. I had so much pain in my ribs that I couldn't sleep more than an hour and a half at a time. And I was waking up. And the friend who was with me, because I had a friend with me every night. So one friend stayed up with me because I couldn't go to the bathroom alone. Like I needed help, like, because to take your pants off, you don't think about it, but to take the pants off, you have to do this. Now, if you can't do this, you can't take your pants off. So it was either to be alone and without pants or to have someone take them off. And I was like, no, I think I'm okay with people taking my pants down. And as soon as I understood that I could use the bathroom myself and wipe myself, I was like, I'm fine with everything else. So I had a bunch of my friends over.
You asked me to take off your pants on the day of my daughter's wedding.
I had this one friend who he was having so much fun putting my pants down. So like the bathroom was like a corridor, right? So as soon as I go through the door, he would rip my pants down. And I was like, motherfucker. And he would start laughing and I would kind of like waddle all the way to the toilet and he was like, have fun, baby, you know? And it was where was I going with that?
No fucking idea.
Yeah, so that was the amount of autonomy that I had the first few days. And the thing that drove me crazy was that I couldn't adjust my pillow. Like I couldn't do this, you know, and I had to always have like someone adjust my pillow. And that night after they changed the bandages, I was like, with the pant pulling friend, that same guy, he was there for me, man. Like he was really like Damien, and I want to do like a stream with him as well. And we're there in the living room, and the pain from the crushed rib, I thought I was really bruising a bone, you know?
Yeah.
I thought like this is bad, like this is not supposed to hurt this much. And he's like, okay, let's take some painkillers. We take some painkillers. Let's walk around. We walk around. And we couldn't open the bandage because I thought like, you know, we're not supposed to touch it. And it was quite gruesome. Eventually we, like after 3 hours or something, we figured out like a position that I could be in that wasn't so terrible. And I was able to like distract myself. He had like very good ideas on how to distract me. And the thing is, it might sound stupid, but when you're in a lot of pain, try to have your brain engage with something that brings you a lot of joy. You know, like whatever it is for you, if it's if it's like a movie or animals or somebody you're into, like your favorite movie star, just Google, I don't know, like whatever the fuck you're into, like Sinead O'Connor topless pics, whatever, you know? And it really worked for me in the sense that I was just like looking at photos at stuff that, like, you know, kittens and like cute stuff. And it was actually better than the painkillers.
It's interesting you say that, because this reminds me, the reason why I took ibuprofen, as so just non-inflammatory pills in the hospital, wasn't because of top surgery. It was because I couldn't fucking sleep because I had back pain from the compression vest.
Yeah.
That's what I was in pain over.
Yeah.
Nothing else. It got a little bit better at home because in the hospital I wore it on my skin, and at home I did it like you do it, on top of a t-shirt.
Yeah.
That made it a little bit more bearable, that it wasn't always cutting into the armpit, but of course the pressure was still on my ribs.
So after that, I was like, okay, we need to like find a way to have this thing not cut into my goddamn ribs. And I started folding it up. So instead of like having 3 stripes, I had 2 stripes, and one of them was double pressure.
Yeah.
And it was like I could tolerate that a little bit better, but it was still pretty fucking hard. So by the end of like the 8th day or something like this, we went and we started looking for a 2 stripe band like the one I'm wearing now, and we couldn't fucking find it. So my mother actually cut the thing up and sewed it again. Yeah.
Yeah.
And we did that for like 2, and after another day we bought another one that we actually found. And I have to say, if you are with a 3-band one, ask your doctor, ask your nurse if you can change for the 2, because most guys, they're not that big. And you don't need a 3-band one, because if it cuts into the bottom of your ribs, it's really hard to breathe. So on the 10th day, on the 2-week mark, I was called in again to have the stitches removed. And that's when I got some good photos of my chest. Like before that, I only had the photo that the surgeon took inside of the surgery, and the photo from the first time when they took the drains out, when they changed the bandages. So for me, when they took the drains out, it was like, you know, they didn't really like, even like I could see the scars, but it was bloated, and it had a hematoma. It didn't look like anything. I was still like excited, and I sent the picture to everybody, but it was an ugly fucking picture. And by the time they took the stitches out, it was already looking very good. You know? And the swelling had gone down, and you could see the lines, and you can see the nipple placement was good. And for me, when they took the stitches out and they said, okay, from now you do this at home, you know, and the first time that I stood in front of the mirror and I, like, you know, in this moment when they were cleaning me up from the back, like my mother and a friend were cleaning me up from the back, and I stood in front of the mirror and I looked at my chest, I was like, I was not even smiling. I was just like, you know, you have this moment where you're like, who is this dude?
I have this too. When they first opened the compression vest 2 days post-op to see is everything healing nicely, they took a photo for me on my phone.
Yeah.
I couldn't believe it. I mean, still taped, but you could see it's flat, right?
Yeah.
And I had a nurse ask if I need help washing myself. And I had so many nurses in to help me adjust the bandage, just retape, blah, 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 bring me food. And I was shirtless most of the time. And obviously in front of all the doctors. And I kept thinking, just a couple of hours ago, this would have fucking killed me, right? To be seen topless by anyone. I mean, I got over it for my surgeon, but that was it.
Yeah.
Like, there were like 20 people in a day that saw me shirtless now.
Yeah.
And also without the compression vest. So, yeah, on one hand, I couldn't believe it. On the other hand, it was so natural. I was already feeling so much more comfortable in my own skin, you know, that I went essentially from 0 to 100, like let everyone come in, send a TV crew, take pictures, make a documentary. I don't care, you know?
Yeah. Like all of a sudden it's like, you know, when my friends were touching me here to put cream, I had a feeling like, why are you like this is not somewhere where somebody touches you when you have breasts.
Mm.
And
Right.
I was feeling like a little bit of an intimacy breach, like, please don't, you know? And then I was like, no reason.
Yeah.
There's no TD there, it's fine. And that first moment of like standing and feeling like the wind on my back from the window and looking, and I felt like somebody came in the room and I didn't feel naked.
Mm.
And you go, wow, it's
That's
so big. You know, it's so big. And I was always the kind of guy that was like actively working to be very comfortable with my nudity. Because like, I hate the fact of limiting myself with anything because of any reason. So I had worked very hard to go topless to the beach, to swim with women's swimsuit, I've taken my shirt on stage. Like I've been topless on stage a few times with tits and everything, you know?
Mm.
And with bras and of course like with intimate relationships always. And I have never a single time liked it. And now it is just the glorified absence of any kind of discomfort. Like it's not even about comfort, it's not uncomfortable.
And it's interesting because on one hand, that's with dysphoria talking. On the other hand, obviously the female breast is sexualized.
Yeah.
Regardless of whether you personally have a problem or not with having it, it is sexualized.
Yeah.
Just the nipple, not even the entire tit, just the nipple. It's fucking nuts. Like you can post on social media the entire breast, but have to censor the nipple. The areola, yes, can be there. The swelling, so to speak, right, can be there. The fat tissue, but not the nipple. Okay.
This is fucking ridiculous, man. So, actually, there is a photographer who is taking photos of me from like he did a before session, and he came and he did like a during session. So we took photos of like the bandages and me changing them and the skin sores and the rest of it. And there's going to be another photo session when everything is done. Mm. So it's going to be very artistic, and I'm writing something and they're writing something, and it's going to be like a very like it's going to be like an artsy thing. I really want to do that, and it's going to be very public. And maybe that's like the big thing, you know, that suddenly, like for me with this experience, because I had friends with me up until the 7th night. I had someone sleep in the house just in case I needed something, and they came and they adjusted my pillows and they helped me in the bathroom and they gave me my pills, and like they talked to me like I was a child, and they told me to drink, and like everybody who gave me the drink, like that, I had a bottle with a little straw, and they all did this.
Yeah.
And I'm like, son of a bitch, sit down.
Yeah, you see, because when I was at home after the hospital, I was also alone, right? Even after that, I didn't have anyone to come take care of me. And that was fine. I didn't need it. I did everything myself. Started showering. When was I allowed to? Like 6 or 7 days after I was released, they told me, no, you can shower by yourself. I think like I did everything that's not walking my dogs.
And did you have to go off of testosterone?
No.
But so you applied, you shoot, or do you put cream, or?
I put gel on in the hospital and right after again. They did tell me if you get a depot shot, so you're not on a weekly shot but for longer, they want you most of the time to not get your shot until after surgery. Okay. So postpone it, because they believe that it could be blood thinning or increased bleeding. But this doesn't apply to you if you're on gel or on
Yeah.
patches or whatnot.
This is weird because they did ask me, like, are you on blood thinners like 5 times? And I'm like, no, I'm a young motherfucker and I don't have any cardiopathy and I've never had blood coagulation issues in my fucking life. And I would let you know if I were on blood thinners because there would be a chance that I would bleed out. They're like, are you on heparin? Are you on heparin? And I'm, no. And I was asking the testosterone question because the most, I think, unprivate moment for me was when somebody else applied my testosterone on me. You know, we were in the shower and I was like having to ask my mother to put my testosterone on, like she put it on like my leg because we couldn't do it on my back. And just the feeling of like my mother putting my testosterone on me was perhaps the single strangest and most full circle part of this whole transition, because like I'm transitioning because I wasn't born out of her body with this hormone, right?
I can see that, yeah.
You know, and I've spent so many years hiding it from her. And then she takes the testosterone gel and she puts it on my body because I had top surgery and I can't do it for myself right now. And I was like, this is a lot to process. And the next thing was like, this is a ritual that I do so privately every day for the longest time, you know, and suddenly it is something that another person does to me. That was very odd. And
I can see that,
yeah. Yeah. And
you know, I have, the nurse asked me when she, do you need help washing yourself? I said no. I did have her right the day after surgery put on my tea for me on my shoulder, the gel. I could have reached my leg, my stomach, but she did that for me. And then the next day I started doing it myself again. So mobility was, that's what I'm saying. Obviously for me, it wasn't an intimate situation like it was for you.
Yeah, but it's still like having somebody do it for you, you know? And I think like the craziest moment of the whole thing was when the next morning she goes into my room, my mother, and she says, have you put your testosterone on? And I'm like,
put it on now.
Did you honestly think I can forget? I have not forgotten this one day in the past 4 years. Do you think I will forget?
Right.
And it was like your mother telling you to put on your testosterone.
Eat your veggies. Put on your tea.
Veggies. Put your tea on. You know, it's like there is one dysphoric child out there who needs to hear this.
Yeah.
It really, you give your parents a chance to change. You know, my mother, she didn't start out asking me if I put my testosterone on. You know, it was, she had a mile to walk. You know, she had to understand a few things about me and about herself and about the world. And she's a very kind and generous woman, but she wasn't raised in this epocha. She was raised 60 years ago, you know, and this shit was not taught in any fucking school that she went to. So give your parents time, let them know slowly if you can, and try to be patient with them, even if they don't accept you as you need to be accepted and love you as you need to be loved right from the get-go, because there is a chance that they will get there. Like for us, it took approximately 7 years for her to be all the way good with this. Like good, like she sent her friends pictures of my tits, you know, like with the scars and everything. This is my new son, you know, congratulate me on the birth of my new son. And this is it's an amazing moment, but I never had that expectation from her.
I know.
You know?
I had a similar experience with that. So I knew my mom wasn't transphobic or anything, but you know how we say, when it's my own child, it's different. I knew she was cool with trans people in general, and I said this in the previous streams. I was always very open about how I identified myself, how I saw myself. If I was clashing with the outside world, and my parents didn't allow me to transition, take any such steps as a child. And I said to her, when having surgery and going on TRT was a possibility for me, I said, Mom, recall this, recall what I said to you, obviously, yes, I'm doing that now, etc. I'm giving you time to process this. But if I have to decide between transitioning and you, I'm going to pick transition. And she had a meltdown over a couple of things, changing my gender marker. And when she realized that I wasn't just having a hysterectomy, but also a mastectomy and everything. But on the other hand, she always offered to drive me there or to come pick me up or pick something up from the pharmacy, So it was coming together is what I'm saying, but it was pretty exhausting. Yeah. But yeah, when I was in the hospital, she called me and she said to me, can I tell people why you're in the hospital? And I said, I don't know. Honestly, I don't care about your friends. I don't know. Really? And she said to me, I want to tell people that you're my son. I want to tell them that's my son. My son is trans. They know you as my daughter, so I'm going to correct them. And my son is having the surgery who he has wanted to have which he wanted to have for so many years. I was really touched by that because I didn't expect that. Like, she wasn't against it any longer at the point I was in the hospital, but I didn't expect outright support from her,
It is big. It is big. There is a big difference between being tolerated, accepted, and celebrated.
And I believed her that she wanted to introduce me as her son. Yeah. And that she wanted to correct people. And that she wasn't ashamed of me and inconvenienced by me, but that it was okay at that point. And that took us at least 2 years to get to that point.
I think like the thing about our parents spontaneously introducing us to other people as their male children has to be the end of a very long process for them.
Yeah.
Because I think a lot of people really blame themselves about anything that their child goes through. And I think a lot of like the trouble that they have in like accepting the fact that we have transitioned and everything is like they feel very guilty about the way that they brought us up. Like my mother told me in the few days that we had after surgery, when I was already feeling well enough to like do like touristic stuff and go out to eat and stuff like that, we had a few conversations, relaxed conversations in the sunlight, enjoying some kind of touristy shit. And she says to me, I had no idea, what you were going through and why and all the rest of it. And I don't know how I would have reacted, and it was also like a very different world. Like the possibilities that we have now did not exist. And there was no way for me to go on blockers and then hormones, like if I had come out of the closet at 6.
Yeah, I would have had those possibilities. But like I said, just no. But that wasn't because my mom is such a terrible person. Like I said, I knew she was cool with trans people. Yeah. She was also cool when I came out back and then, pre-transition, as gay. Yeah. Which I don't identify as now any longer because I found something better. But yeah.
Because you're a fucking straight guy.
Right? It's still weird, but yeah. It's. Yeah. But a lot of that had to do with my mom really being under my father's thumb, so to speak, under his control. That's why that wasn't going anywhere. Had she found a way to break free from that, I think I could have been one of the kids who transitioned before 18, yeah. Because we have the medical means here.
That is, wow. That is, yeah, I hear a lot about children who want to transition. It's a huge thing, but I think like for me, if I could have transitioned as a child, I would have been a very different person than I am today. And I can't say that I wholly regret it. And I can't say that my mother would have let me done it. You know, it's really like a complicated what if chain of what ifs, that neither I nor her can say like, okay, if this was the situation, then this would have happened. I think your case is kind of very clear cut because you have a very good understanding of yourself, and you always had. And and I don't, and I never had. I feel surprised by like how thrilled I am to be the way I am right now, and how unexpected this is. And I think like it's really important that we understand that our parents have a lot of guilt around everything that's happening with us, you know, and if we kind of accept it and have a little bit of compassion for them, then sometimes it can bring us very close together. And at the end of the day, a lot of people have to choose, like you said, between transitioning and the family. And if there is any way to not do it, then really having support and being accepted, and I'm not even like saying celebrated, because some parents will not celebrate their transgender children. Like, it's shit, but it happens. But being accepted is a huge difference in everything, in the suicide rates, in like the economic stuff, in the mental stuff for sure, you know? And yeah, that's what I wanted to say.
Yeah, and guys, I can sign this off. I mean, I only, as far as support is concerned from my family, I only have my mom on my side. It was really fucking bad before transitioning already because of this openly identifying as lesbian thing. That really shook people, and even though it wasn't a secret or anything, right? Like, I always said this as a kid, like, I like girls, whatever. But people were hoping I was growing out of it. And I figure if you're someone who has such a problem with lesbianism, masculine women, whatever, wouldn't the person transitioning kind of be the better alternative? Like, if you're that bigoted, when you think like a masculine trans guy is better than a masculine woman or something, I don't know. Forget about it. Forget about it. God made me this way. God made me female. Nah. So what I'm saying is, I wasn't expecting people to say, Niki Forrest, you are fucking, you are the manliest man that has ever lived. We love you. Go on, boy. I wasn't expecting that at all. But yeah, the end result is, don't expect to see me in the village, you know, with my people, with my family. Forget it. Persona non grata. Banned, blocked. Forget about it. And that's okay. I don't need people like that in my life. But I did think that maybe my mom would be one of those people, you know, who also would, she wouldn't cut me off, but I guess I would have to cut her off to decide for transition. We gave her time. And now she's my biggest supporter. I'm glad to have that. Didn't expect that in the beginning.
So that is something to be said for patience and for age, because you're not 12 anymore. And also, nah, come on, you look 13. And you got a little pedo stash.
That's making me 13, not 12.
Nice.
Next year, 14. Yes.
So I started getting like 28, 29, and I was like, no, I want to stay 25 forever. So there's really something to be said about chosen families, no? Because a lot of trans people, they really have to choose their family. And I've had this experience this year that I've chosen someone to be my cousin, and they've chosen me to be their cousin. And when you come from a family where staying together is not expected, you know, I don't come from a ruined house, but I never had any relationship with my father. Like, it is not something I take for granted that you actually have a relationship with anyone who's your blood relative. And the thing about chosen family, that it's a practice that's been done by queer people over centuries, because we've always been being thrown out of communities because we don't respect the hetero-patriarchal norms, you know. And if you are in that situation that you don't have your family, your blood family around you, then a chosen family is something that you need to have, because it is such a strong basis for your life, you know. It is so crucial that you're not alone, that you at least have one person that you know that he's family, that they're family, chosen or blood. But you need to have one person like that at least, you know.
You know, our viewers don't know this. I told you this before. I didn't have friends until I was 23 or 24.
Yeah.
I don't need them. It's good if you have them. You should be having them. I don't need them. I've proven that, but having them is much better. And the friends that I do have, I'm very close to. And I realize that a lot of people in my position, you know, go throughout their entire lives without having friends. Honestly, I could revert back to that every day. I could always end up again in a position where I don't have any support network, where I don't have friends at all, because my family doesn't want to have anything to do with me. And I was surprised how supportive my friends were, and not just them. And this, what I'm going to tell you, highlights that I've chosen good friends. The friends of friends and the family of friends have been supportive of me. Those are people, they don't owe me anything. And they have been so supportive of me. This is the first time in my life that I'm getting support. And I fucking need it, considering all the legal and medical issues I'm having here. But there is so much kindness and so much openness that I've been given that I never expected before. I would have been naive to expect it because I've never felt it in my life. So at times, good things happen. You find them where you least expect them.
This is really an amazing process about when you ask for help, you know, somebody who's been very independent, very, very self-care, like completely self-dependent the entire time. And you never used to ask for help, and then you find the people that you're actually able to ask help from, and you ask them and they show up, and you're like, whoa, you know. And this happens a lot around surgeries, and it happens a lot around like big life events, and transition has some big fucking life events in it. And when you realize that you've built a community around yourself, and you don't really have to be alone with this stuff unless you want to, you know, but you don't have to be alone with this stuff anymore. It makes you feel so much less of a weird monster. You know what I mean? You're not that weird thing anymore. You're just the friend who is trans. Like, you know, you have that friend who's a musician, and the friends with 3 girlfriends, and the friend you have one too. And maybe you don't know because they don't tell you, but there is one of them. And
I know.
Yeah.
They don't know that I know.
Maybe they're polyamorous and everybody knows, you know. And then you just get to be that person who's the trans friend, and you have your little niche, and you tell your special stories, but you don't feel like a freak anymore. It's huge. It's huge.
Yeah.
Yeah, it's really normalizing. Okay, we're gonna have to finish here because we're like 2 hours in, and I don't know, like if YouTube has like a time limit on my shit. And we're gonna do another one on rehabilitation, right? I'm writing everything down. Niki wrote everything down. We come from very different disciplines. Niki does, what the fuck do you do?
Yeah, powerlifting. I used to do bodybuilding when I was a teenager, went to powerlifting, meaning heavy compound barbell movements, some Olympic weightlifting, but not very well.
Okay, so he does that masculine shit, and I'm a little circus fairy. So
notice though how it took me a moment, like, what are you doing? And I'm like, what am I doing?
Who am I?
That's a philosophical question. Yeah.
Yeah. What do I do? So when we like, also you have a little bit of rehabilitation to do after your surgery, like your touch-ups, you know, you're gonna be with the thing again, and
yeah.
maybe do a little bit of like very gentle rehabilitation after that. And then we're going to sit here and do another podcast comparing notes, because we are obsessive like that. Okay.
That's true.
That's true. And I'm writing everything down. Okay, so Niki, thank you so much. You are so good at telling your stories. You know, you have a really like a storytelling style that I enjoy, because it's kind of like it has details, but it's also kind of like sarcastic, and it makes the horrible stuff kind of funny. And you really tell like difficult experiences in a way that I can tolerate, you know, and relate to. So I want to thank you for sharing all this. And
you are very welcome.
And
let me say one moment. Yeah. This is the first time someone has ever said anything like this to me in my life. Normally people go, oh my God, Niki, shut up. You are info dumping me. I don't need the entire Nikipedia.
Well, this is a postcard, sweetie. We need to fill up 2 hours. So I want the Nikipedia. Okay, so thank you so much for today's episode, and we're going to do this again. I'm also going to be back with like shorter videos, like just updates on top surgery. On September 10th, this shit comes off, and then I'm definitely doing a video to show my chest to everybody. Exactly. And Niki,
I'm going to clean my glasses on September 10th.
Yeah, you. Is that, do you only wash on special occasions, or is that just?
No, I do clean them every day. It was sarcasm, yes.
I used to have glasses, and you know, like the hardest thing that I had to stop doing was take them off to clean them.
Yeah.
Yeah, it took me like a year.
I fucking hate it. I want to get laser surgery so bad. I fucking hate it. I've only had them for the past 2 years. I always thought I have a bad right eye and a good left eye. Turns out I have a very bad right eye and a bad left eye. I really needed glasses, is what I'm saying. Never knew how bad that was. And I want to get them lasered. I hate it. But I can't afford it.
we can talk about, we can talk about it kind of in a different podcast, because that's a surgery I had. So we can chat about that too.
Oh my God.
You have to look into the light.
Fucking augmented.
Okay. So we're gonna finish here.
My coach had the laser surgery without anesthesia. So
Niki, shut up. We're going off.
The entire Nikipedia about eye surgery. Not.
We're gonna do that just another day. Okay, thank you so much, man, and thank you to everybody that's been with us, that's been listening. And last words. Perfect.